All right, I believe we're live. So, this is a video I've been hoping to make for quite a while. And before we get in this video, let me do a few introductions. My name's Jay. I am the owner of Section8Consulting.com. I've made videos for around 10 years to educate people. I am a Section 8 consultant, probably one of the most well-known in the country. Work with around 1,000 clients a year, helping them navigate the system, achieve being able to get vouchers, low-income housing, affordable housing, and so on. One of the greater demands I've seen in the last 4 years is accommodations. We get a lot of requests for it, and I've authored probably around 200 pages on this subject matter. But today, I think we're going to cover around 5 or 6, maybe even 10 pages of it. And this may be a part 1 and part 2 video. Now, it is pretty contentious because, like a tree, you have a trunk. For every subject matter we cover, and it can be extended into other what ifs and maybes along the way. And so I could probably author a whole book on the subject matter, but I find that the information we give is probably the most concise and will definitely help you better achieve your goals for accommodations and modifications. So one of the things that we intend on covering is going to be first and second notice of reasonable accommodation letters. And I want to also be very clear from the beginning of the video. This video is in relation to accommodations and modifications for those of you that are disabled and dealing with Section 8 housing, low-income housing, affordable housing. This is not about those of you with jobs and other accommodations or other battles outside of that of government-financed housing or vouchers. If you're looking for that information, I will not be covering that, so you'd want to click away now. So first and second round for reasonable accommodation letters. Notice of federal rights to provide your own accommodation letter. Housing search deadline extensions. Many of you like an accommodation when you're utilizing the house search to utilize your voucher and you need extra time. I guess policy exception for those that already have a voucher, that are in a home, apartment, or so on. Maybe you've got a serious health crisis and you need a family member to be in the home for a couple of months. And well, there are ways to handle that under federal law. Also, additional room accommodation. Many of you guys are looking for ways to expand the number of rooms you have without having a larger group of people living in the family composition in the home. Contract accommodations, complaint letters, and for accommodation denials, an exception to the payment standard. Some of you are looking to increase the value of the voucher. In other words, you'd like them to pay more against rent or allow you to rent a larger property with a higher payment standard. Live-in-aid accommodations. Many of you guys have had battles with landlords that don't appreciate you bringing in nurses and doctors and other people in the property, including family members that may be qualified as a live-in aid. And so there's a way to handle that. Unreasonable live-in and aid accommodation letters as well. There's a way to battle it if they do deny it. And part of the policy towards a lot of accommodation is denial. PHAs, or public housing authorities, or a lot like insurance companies, they love to deny. But a lot of times they have just cause to deny you because many of you simply do not are unapprised of what you should be doing and how this actually should work and how you should meet the intent of the federal law. Special exceptions. Now, one thing that I want to cover is the unreasonable and special exceptions to assistance of animals and service pets and emotional therapy pets, okay? Special exemptions for medical marijuana use, depending on the state you're in, and special exceptions to current illegal drug use. I don't mean that this is a legal method for you to use illegal drugs in your apartment. I'm just suggesting that under that current policy, that under rehabilitation, if you're no longer participating in that and you're in recovery for alcoholism, other issues related to drug use or prescription use, there could be some special exceptions afforded to you. Now, as we get into this, I'm going to get into the part you're all looking for. I know you're all dying for me to just get to the point, but look, this is an expansive topic. We need to be able to cover the basics first. One thing I'm going to let you go and the guys know is on August 10th, our office will be beyond offering case management services. We will be offering services related to a number of accommodation letters. Many of you simply don't get it right, even with instruction of a video. and it's quite extensive in different areas. So we'll be offering that service, I think, at a preferential starting point of $195. Now, I realize people aren't making money, okay? But let's be honest, between the research, a 20-minute consult, and actually writing the letter, I think that would be appropriate pricing for that. You don't have to do anything. You can simply pull out a loose piece of paper out your purse and put an ink pen to it and see how that gets you along and whether or not you get your accommodation. I would think for most of you wanting more rent or an extra room for a lifetime that would be a fairly good deal, but you're under no obligation to hire our company, anybody else to do these letters for you. You can do them yourself. So that will be becoming available through our booking software on or before August 10th, okay? For those that want it or need it or simply don't have the time to fool with it, okay? So talking about everything you need to know about reasonable accommodations and requests for housing, I'm going to pull up from our notes because, again, it's pretty expansive. Accommodation exceptions for housing policies, accommodations for deadlines, communications and meetings, accommodations for moving, porting, and transferring. In other words, moving that voucher, accommodations for building modifications and requests for living aids and reasonable accommodation request, disability discrimination. What we will not cover is going to be medical expense deductions, applying for elderly or disabled buildings, income deduction for disabled families, and applying for disability preference on a waiting list. Those are different rules and apply in different ways. So now that's going to be what we're going to be going over. So let's get to the main part. Who can make a request for reasonable accommodation should be the first thing we should establish. A reasonable accommodation request can be made by any person who is disabled. Again, you need to be disabled. If your child or someone else in the household is disabled, you can also make an accommodation request on their behalf. In other words, under 18, or if you have limited or durable power of attorney over such said individual. If you are on Social Security disability, you will definitely qualify as disabled. If you're not on disability, you may still qualify if you have a chronic illness or other physical or mental health condition that significantly impairs you. Now, what we're going to do is discuss the Fair Housing Act and its definition of a disability. And I want you to pay close attention to this. If you don't have a pen and paper, then I would advise at this point to bookmark this video so you can come back to it, because this is going to be the three single most important lines I'll probably talk about. So the definition of a disability, number one, any person who has a physical or mental impairment that substantially limits, and here comes the major part, major life activities, as of having record of an impairment or is regarded as having an impairment. This doesn't mean that you went down to the dollar store and purchased a cane or a wheelchair, okay? It means that you have a mental impairment, you're being treated for it, you're probably on medication, or it affects major life activities. Now, let's talk about what that may be. In general, a physical or mental impairment includes hearing, mobility, visual impairments, chronic alcoholism, chronic mental illness, AIDS, HIV complex, mental retardation, low acuity, and any of those major life activities, seeing, hearing, feeling, touching, mobility is in getting around, walking, your ability to take care of yourself, your ability to take your medications as required. And then we're going to move on to number three, major life activities, including walking, talking, hearing, seeing, breathing, learning, performing, manual task, and again, caring for yourself. That would be the federal definition. You need to match one of those three, okay? So how do you prove the definition? Now, this information I'm giving you now is what is required before you can even request the accommodation. You need to establish these particular proofs. So let's talk about proving disability. All you will need is a letter from your doctor or medical professional, meaning medical professional does not mean the camp counselor, the pool counselor. It means somebody that has received an associate's, bachelor's, or a PhD in their respective field and is a professional, a psychiatrist, psychologist, a physician, a surgeon, cardiologist. Hell, you can even go to your podiatrist if you need to, okay? If it's a doctor or somebody that has served and is under medical licensing, then yes. So you'll need a professional that includes in the sentence this person meets the definition of disabled under the Fair Housing Act, or if you have a reasonable accommodation form, your doctor can just sign that. Let me tell you that this will also be a long video, guys. This is why we'll have one in part two. When we're talking about reasonable accommodation form, many housing authorities do have that. But let's be clear. Housing authorities love to give reasonable accommodation forms because they can limit what you say, and ultimately limiting what you say could make it so convoluted that there's no reasonable way in which you can win a request for the accommodation. Now, we didn't get into legally how you can get out of using their form and using yours. You're not required to use their form, and it's ill-advised in most cases, okay? So, some doctors think that disabled means that you have to be using a wheelchair or not working. That is not what a definition of disability is. If your doctor does not know what the fair housing definition is, I would advise that you print that out. The Fair Housing, and again, this is what you're going to be Googling, and I will link it up. The Fair Housing Act definition of disabled should be the keywords you use. If you do not need to prove to your landlord or housing agency that you're disabled, or if your doctor or provider writes that you are disabled, that is all that is usually needed. But it's not, okay? Only the small housing authorities that are ill-prepared for this would likely let you just go and write a simple letter. Now, guys, I know you got questions, but the problem with questions are in a live video is we can turn this into a 25-hour video. And so I'm going to deflect to answer questions at approximately another 15 minutes. So bear with me. So let's talk about the third part and element to this. Am I substantially limited in one or more major life activities? If you have chronic illness, you may be wondering if you meet this definition. Many people with severe chronic illness would be considered substantially limited in caring for oneself. If the impairments make eating, bathing, dressing difficult, your doctor may find that you meet the fair housing definition. Many people would also be considered having mobility impairments. You do not need to be in a wheelchair. If your chronic illness makes walking or standing difficult or causes symptoms, your doctor may find that you meet the Fair Housing Act definition. If your illness makes it difficult to perform physical activities such as bending, lifting, and grasping, holding, you might also fall in the criteria for impairment in performing manual tasks. If your illness does not fit into one of these categories above, you may still qualify if it does, in fact, substantially limit one or more life activities. When writing a letter to your doctor, or your doctor does not... Sorry, let me take a sip of coffee real quick. There we go. We're good. All right. When writing a letter to your doctor does not need to disclose your diagnosis or symptoms. You do have HIPAA law that protects you in that respect. You're just simply describing the problems you're having rather than symptoms. But I wouldn't be shy about giving your diagnosis anyways, unless you're just extremely private. Your doctor will need to confirm that you meet the definition and to provide information on what disability limitations you have that make you need this accommodation. And we're going to get into another part of this where we're going to get a little bit more detailed about what the letter is and how to write it, okay? So I know you're wanting that, but in order for to reach that point, we need to get through all this others. That's the thing about knowledge, guys. If you want a quick tip and trick, there are lots of channels filled with idiots that'll tell you lots of things about this, okay? You're not going to absolve yourself and get extra rent, extra bedrooms, and other things by listening to tips and tricks. You will get the actual answer and federal definition and things along with this video with a real consultant, but you have to be patient. So I would recommend just listening and bookmarking this if your attention span is one that's short. That way you can watch 10 minutes at a time to accommodate yourself. So how to make a request for a reasonable accommodation. Small requests don't always need a formal process. Sometimes you can call or email or ask for what you need. I would recommend that you make it a matter of record, that you send in a letter that is certified with a tracking number. That way you know that they have a response time and you have a matter of record that they've received it. For example, due to my disabilities, I'm unable to apply in person. May I please have an accommodation to apply by phone, by mail, or email? Or because of my disabilities, speaking on the phone is difficult. Or you may have some of our clients, even in our company, may have radiation and other issues that they're concerned with using battery devices or plug-in devices, okay? And that's a very real thing for many people. May I please have an accommodation to communicate by email instead? That is a reasonable accommodation that's simply asked for, and usually they should not deny that. If you're requesting something bigger or your housing programs requires you to delve into a more formal process, here's a couple of steps we're going to follow through. Okay, guys? Now, one thing that I'm going to tell you, there's lots of people that have opinions, but rarely afforded by federal law. So let's discuss this. One, my advice is to ignore most people because people share all kinds of useless information, and it's based strictly on what they were trying to do versus what the reality of what might work for you. Okay. So if you tell your caseworker that you're planning to make a reasonable accommodation request, and there's a good chance you'll be told that the accommodation you want is not possible, I would advise ignoring that. This happens a lot. It's very normal. It doesn't usually mean that much. In fact, the primary cause of that is most caseworkers are not apprised of federal standards. In other words, they're so used to denying things and they have very little information in which they understand the federal law that they just simply deny it anyways. So what to do if somebody tells you that you can't have a disability accommodation? Because of improper training for reasonable accommodation policies, I would say to you, they're probably not trying to be mean. They simply just don't know. But one thing I'm going to let you know is with most housing programs, you have a special form, as I'd mentioned, but you don't have to use a form. You can use a form that you want, or you can write a letter. However, as you may have figured out, most housing workers don't respectively use those particular rules to write letters for accommodations. So, all right, so I'm going to take a look and I'm going to give you an example verbally of an example letter. Dear housing provider, my housing worker informed me that she is refusing to consider my reasonable accommodation requests and paperwork. According to the HUD and DOJ Joint Statement of Reasonable Accommodations, a provider may not refuse a request because the individual making the request did not follow any formal procedures that the provider has adopted. I am requesting that your program follow the HUD and Department of Justice regulations, which state that you must consider my requests in the form that I have submitted, and you cannot deny my request because I have not used procedures you have adopted. Please provide me with a written decision on my request for a reasonable accommodation. The key words are there. Please provide me with a written decision for my request, a matter of records. If you're asking for something, do you need to make sure that you're getting a reasonable matter of record, guys? Okay. So you're writing down that reasonable accommodation request and why. So you're writing that down in the letter, and you're giving them a reason as to why. If their form gives you enough space, you can just write attached forms. If you have additional information, make sure your request is disability related. So in this step, I would tell you that there are a couple of forms of ways that you could potentially handle this when writing a accommodation letter. And I'm going to give you two different letters. And this is one part. So the first copy would be from Mr. Adams' doctor, and it says, because of disability, Mr. Adams needs a private sleeping area or area to attend to his disability needs. The boy is 14 years old, sharing a room with his mother, and it's customary in the U.S. for teenagers to have a private bedroom. Sleeping in the living room would not allow that type of privacy. So clearly we have a teenager, we have wounds that need to be cared for. It would not be customary for that particular person to be in that room. And so that ended up being actually denied. How you would get approved. Now, you see, that was very sparse in this writing for that. So I would suggest to you that on the second letter, I'm going to give you a better example of an accommodation request with much greater detail. Here's a copy of the second letter and the doctor's letter, and the main reason listed for her son needing a private bedroom. Bill requires frequent wound care to prevent infection. So we're establishing that incidentally, the health problem requires maintenance. The teenage boy should always be allowed some level of privacy regarding his disability status and attending wounds. 2, sharing a bedroom would create more frequent bathroom trips for room care. So we're seeing that it's establishing other separate actions for the care of this person. This would aggravate his condition, increase pain levels, and worsen his disability. So we've given 5 solid examples as to the actions of why this accommodation would be required. Going on to number 4. In addition, he has increased need for sleep due to the disorder, and a shared bedroom would disrupt his sleep, make recovery from surgery more difficult, and this would add further to his disability. And number 5, his frequent wound care and bathroom trips would also disrupt his mother's sleep, interfering with her ability to do tasks needed in the home and cooking, cleaning, and laundry. So we've established approximately 9 different ways in which an accommodation could be established for one person, okay? And so that would be the type of letter that would be approved under a fair or reasonable accommodation or modification. And you go back and you look at the original letter written, and I'm going to go over number 1 again. This is a less formal one. Because of disability, Bill needs a private sleeping area that attends to his disability needs. Now, that's a request right there, you see, because of disability, Bill needs a private sleeping area, but it's a request with no merit. You're simply advising the housing authority about a potential problem, but you're never describing what it is. And then it goes on to part 2, 14-year-old boy sharing a bedroom with his mother. So there's a presumption that simply because one is a teenager and one is the adult parent, that should be the premise of the entire accommodation. Wrong. You've given no fair or reasonable expectation as to why that accommodation would be reasonable whatsoever. Number 3, it's customary for teenagers to have a private bedroom. Look, accommodations can't be written or accepted or even approved based on what you believe is customary or what you believe is normal, a part of a larger portion of any nation, okay? And then the last one, sleeping in the living room would not allow privacy. Privacy is not an accommodation either. So you have those 3 aspects. It simply doesn't describe the actual need. Now, it would appear that we have a visitor in our video. Let's take a moment. Now, that is one of my kittens. Everybody knows Bunny. He's decided to stop by and do a little hair grooming for us. I assure you the video has not been, I'm not doing this for attention. This is simply his natural behavior. Mr. Bunny, say hello to everybody. All right, guys. So that's Mr. Bunny. He decided to be part of our video today. And it looks like he's going to do a little bit of grooming, and so he'll be my co-host. If you don't like pets, please exit from the channel and don't come back, okay? If you're not a pet lover, you would certainly be displeased with our videos. All right, we're going to move back to the actual content here, and we'll let Bunny finish his shower. And he'll probably shower for a bit, so I hope y'all are ready for that one. All right, I'm going to move back through here, and we're going to talk about exceptions. So, pick a provider. You'll need somebody to write a letter or fill out a form for you. Your provider can be a doctor, a social worker, a nurse, a therapist, psychiatrist, or other professional familiar with your disabilities. Familiarity with disabilities is not the only requirement. You need to be able to adequately describe all the reasons in which it is a disability, what the reasons are as to how it affects you, how it affects your life, and makes it unreasonable. These accommodation letters and reasons can also follow a number of different causes. So, as an example, number 1, a deadline extension. What I'm requesting from my housing provider may give me a deadline extension so I would have more time to find an apartment. Reasons that you might make that request is I am disabled. Because of my disabilities, I need to find a place with no stairs. Because of my disabilities, I need to find a place 3 blocks off the bus stop. Finding an apartment that meets my disability needs, and then also the fact that you may need additional time to search. We'll talk about guest policy exception. What am I requesting? I am requesting that my housing program let my mom stay with me as a guest for 3 months. Here would be the just cause as part of that. I am disabled. Because of my disability, I'm about to have a surgery. After surgery, my ability to take care of myself will be lower. After my surgery, I'll need additional help with activities and daily living. My mom will be able to take care of me and help me with my disability, so she stays with me for 3 months after the surgery. We're going to discuss lightly on additional bedrooms. So I am requesting that a housing program let me move into an apartment with an additional bedroom. And so, or you're asking for an additional. And why you're requesting this, I am disabled. I am disabled and requires daily physical therapy. You would need a room for storage or daily use of physical therapy equipment. And we do have a list of that as well. But storing medical equipment or the use of could tie up a lot of space in a home. Equipment is too large to fit in other parts of the house. And you can list the size of the equipment and space needed to operate. Equipment that can't be safely operated in other parts of the home. And the need for adequate space for in-home sessions for a therapist. Storing equipment in common areas would impair the mobility or create a fall risk. The exercises that you may be participating in may have been prescribed by a physical therapist and are needed to maintain mobility or independence. That's one of a vast number of reasons in which we can discuss additional bedrooms. And we're going to move on. Here's some things that you do not need to include, and that would be your diagnosis, symptom, medical treatment. Your provider doesn't also not need to provide that as well. Again, you're talking about what's happening, how it's affecting your quality of life. You don't necessarily need to disclose that you're bipolar or schizophrenic, okay? However, it would be a little bit helpful if you did so, but you're not required to put rules. So what we're going to do at this point is we're going to discuss further forms of how to describe disabilities. And in description of disabilities and kind of describing those, one thing we're going to do is cover some of the aspects that may be covered for mental health. So we'll say that Bill has agoraphobia, panic disorder, multiple chemical sensitivities, ME, CFS, mast cell activation syndrome, and so on. Now, that is one example of just describing all the things that you have medically received as a diagnosis. A more helpful way of addressing that is Bill has a disability that makes him or her unable to rely or attend scheduled meetings outside of her home. This person has a disability that causes her symptoms to worsen during in-person face-to-face meetings. This disability impairs that person's mobility, leaving that person to have worsening symptoms. The disability causes symptoms and worsens when they go into office space or public meetings, so agoraphobia. A disability that makes a person homebound when they're unable to leave. And then we talk about walking upstairs and other issues related to walking and mobility. You could describe that person as having Lyme disease, POTS, ME, CFS, and so many other things, or you could approach that from a more helpful perspective and say that the disability impedes the ability to walk upstairs, and walking upstairs worsens the symptoms. And you could also say that walking up long flights of stairs are difficult. Walking up more than X number of stairs worsens symptoms. You could suggest that any action on stairs would be very difficult without an elevator. And of course, the disability could prevent that person from actually doing it at all. And then we're going to talk about a little bit of the search for landlords and how accommodations work in respect to that. So we're going to say that Bill has agoraphobia, depression, social anxiety disorder, Lyme disease, ME, CFS. And that could be one way to diagnose, say that your diagnosis is, but you're presuming that the caseworker would know what the diagnoses are. A better way of handling this is saying that you're unable to reliably attend scheduled meetings with landlords, that your disability limits the contact with the landlord and the arrangements set up for those appointments, and that you would need additional time to support those tasks. The disability that makes that person, their particular disability would make them homebound. There are symptoms and causes that worsen because of the search, and so it may impede your ability to be able to have the full use of the time that you're requesting. And the disability causes symptoms to worsen with forced air, carpets, and other things. In other words, we have chemical sensitivities and the after effects of that. So I think that's where we're going to call a wrap point, because my lungs are getting tired here discussing these things. So I'm going to move on to some comments here. Michelle Bond, I just sent a reasonable accommodation yesterday to my apartment. And we're moving in for a new voucher. Did not send a note for position. Okay. C Green says cute. I assume that's in relation to Bunny over here giving himself a bath in the middle of my video. Lou Manischetta boy, my bunny needs his daily loves. I appreciate that. Radiant Jewel says adorable. And then Ellen says, hi, bunny. So it appears that more people are curious of my little bunny and then my video. So that's okay. Well, guys, let me wrap this up and just say this, okay? You guys can take this advice and use it the best way you can. I think ultimately what we're saying is, if you're going to write an accommodation, you need to provide the federal rules in which are afforded to you, okay? Caseworkers don't know everything, and they certainly, as many times, don't know much. And I would tell you that first you need to apprise them of what your rights are, what you're requesting, what it is, how it's affecting your quality of life and other major life activities, and describing that in detail. And then following up and letting them know what you require under federal law, which means you need a reason, or if you're going to deny the letter, then you need a reason, and by mail or by letter, be descriptive as to why. If you're struggling with this type of letter, getting through that again sometime between now and August 10th, I'll provide the service because I find that a lot of people call our office about this, and I think a lot of people struggle with it. There are successful letters and there are unsuccessful, and I may also put a secondary service to review letters that have been written by you guys that may simply just need to be modified, okay? All right. Take a look at the last comment we've got here. I'm applied for Section 8 and then just stabled, cannot climb stairs. I'm on a waiting list, but I didn't put this on my application. Well, accommodations aren't usually afforded on applications. That is something that should be requested at the time of actually getting the receipt of a voucher. That way you're able to let them know preventively. So until they accept and are prepared to cut you the voucher, that would be the appropriate time to address accommodations. They don't typically ask whether you need one during it. Now, the only type of accommodations pre-application or pre-voucher you could probably ask for is an accommodation to have the interview by phone, email, and so on. But it isn't until you actually win that voucher that you can start talking about accommodations and modifications. So, all right, guys, I'm going to wrap this up, and I'm going to take Bunny outside because it looks like he's ready to go enjoy himself. Y'all ever wonder why my office chair is trash with all those holes in it? A lot of people, hey, Jay, why do you got such a horrible chair? Well, it used to be a beautiful chair. But when you father around 30 cats, every time the little toes touch something like pleather or leather, they pop holes. And I would have to probably replace my chair every 2 weeks. So as much as this is my consulting chair, there's no preventive way for me to stop my cats, okay? They're always going to pop holes, and many of them have been birthed and even loved to death in this chair. So it's a comfort to my cats. So I'll always have a very, very shitty chair, a very nice chair, except it'll have a lot of holes in it, okay? I'm not going to change that. If that seems a lack of professionalism, then tough shit. I love my cats, and they'll always be part of our videos, and so will the holes in my chair. And of course, now that he's had a shower, you'll see he's missing his tail as well. He's going to take a nap, and this chair has a lot of memories for him, along with many of my cats. Like if most of you remember Little Mama, she used to sit up in this chair since a baby. So a lot of my cats recognize this chair as like a baby blanket. So I'm not getting rid of it. I'm not going to go purchase a new pretty one. The old raggedy chair will always just have to be in my videos. So. Ellen, let's see. Ellen, thank you. Michelle Bond says thanks. Beauty Marks, of course. All right, guys, I've enjoyed talking with you guys, and I hope y'all enjoy your day. I don't think we're going to do a part 2 to this. We'll see what the response is. I don't think that this needs to go much further than what it is. To be honest, I'll probably just author a book and then publish that. But I don't think that it's to that serious of a degree. There's a lot to be discussed in this. I think it's better learned through practice of just talking with people through consults because, every situation is different. And sometimes you may feel you have a great case for an accommodation, but you may, and sometimes you can formulate a better case. All right, guys, with that being said, I'm going to go enjoy my day with my bunny here, and we'll see y'all next time. Bye-bye for now.